Welcome to another episode of Med Madness, where we break down complex medical topics into clear and concise explanations to help you excel in your studies. In today's episode, we'll be diving into the topic of choriocarcinoma, a rare but aggressive form of gestational trophoblastic neoplasia. We'll explore the risk factors, clinical presentation, diagnosis, and treatment of this condition. By the end of this episode, you'll have a solid understanding of choriocarcinoma and its implications in clinical practice. Next, let's discuss choriocarcinoma itself. This is a malignant tumour that arises from placental trophoblastic tissue. Although it is rare, it's essential to recognise because of its aggressive nature and potential for widespread metastasis. This condition most commonly develops after a molar pregnancy, but it can also occur following a normal pregnancy or a spontaneous abortion. Now, moving on to the risk factors. The primary risk factors for choriocarcinoma include advanced maternal age and a history of a complete hydatidiform mole. These factors increase the likelihood of the abnormal trophoblastic proliferation that characterizes this malignancy. Next, let's discuss the clinical presentation. Choriocarcinoma often presents within 6 months of a pregnancy. Patients typically exhibit symptoms such as amenorrhea or abnormal uterine bleeding, pelvic pain or a sensation of pressure, and an enlarged uterus. However, what makes choriocarcinoma particularly concerning is its propensity to metastasize early, especially to the lungs. Pulmonary metastasis can manifest as chest pain, hemoptysis, and dyspnea. These symptoms, combined with a history of recent pregnancy and abnormal uterine bleeding, should raise strong suspicion for choriocarcinoma. Now, when it comes to diagnosis, the first step when choriocarcinoma is suspected is obtaining a quantitative BHCG level. This hormone, produced by the tumour, will be markedly elevated. Imaging, particularly a chest X-ray, is also crucial as it helps detect lung metastases, which are common in this condition. It's important to note that further imaging, like a chest CT scan, is generally not necessary unless there is a need for detailed assessment, as it does not change the management plan. Next, let's talk about treatment. The mainstay of treatment for choriocarcinoma is chemotherapy, which is highly effective even in cases with metastasis. Early detection and treatment are vital for a favourable prognosis. Now let's consider a real-life case study to illustrate these points. A 30-year-old woman presents to the clinic with complaints of irregular vaginal bleeding and pelvic pain 4 months after a spontaneous abortion. She also reports shortness of breath and has noticed blood-streaked sputum over the past week. On physical examination, her uterus is found to be enlarged. Given her recent pregnancy history and these symptoms, the physician orders a quantitative BHCG test, which reveals significantly elevated levels. A chest X-ray shows multiple nodular infiltrates in the lungs consistent with metastatic disease. The diagnosis of choriocarcinoma is confirmed, and the patient is promptly started on chemotherapy. Fortunately, with early intervention, she responds well to treatment and her condition stabilizes. To wrap up, choriocarcinoma is a rare but aggressive form of cancer that requires early recognition and treatment. Key points to remember include its association with recent pregnancy, elevated BHCG levels, and its common metastatic spread to the lungs. Understanding these elements is crucial for timely diagnosis and effective management. Thank you for tuning in to this episode of Med Madness. Don't forget to engage with our pre- and post-podcast quizzes and explore the accompanying Anki flashcards to reinforce what you've learned today. Your active participation will help solidify these concepts and prepare you for success in your medical journey. Until next time, keep studying, stay curious, and remember, knowledge is the best medicine.